This is Dr. Alvin Philippos, and we get a lot of questions asking about what is the hype about high dose vitamin C and the affiliation with chemotherapy. So, Venturis has been in business for over 25 years, and we have a wide variety of practitioners, including medical and alternative, working together. So, high dose vitamin C and chemotherapy, it's basically an integrative approach to oncology where we let the medical side of things and your oncologist do things that need to get you better and fight this horrible disease. And high dose vitamin C is a very potent antioxidant, and at high doses, it reaches this pharmacologic level not achievable by oral. So, orally, you can only take so much because it's so acidic, but you can actually do 50,000 units or 100 grams of vitamin C over a slow period of time. And the studies showed that it's a really good adjunct therapy for cancer. Now, we actually will use other IVs along with that, but it's a very, very emerging interest, especially for the medical community, because it's shown that it really enhances the patient's outcome. The mechanism on this is that vitamin C is one of the strongest pro-oxidants out there, and at high levels, it produces hydrogen peroxide in the tumor tissues, which causes those cancer cells to basically explode. We want to be able to destroy it. Now, the new science is where you can actually use photobiomodulation, and you can do things like sound wave therapy. You can do laser therapy directly onto the tumors after a delivery of these type of IV infusions and help kind of fight off the tumor cells. But the potential to inhibit the growth of these tumors is significantly impacted with things like these treatments, and it just supports the immune system overall as far as increasing the immune system and decreasing inflammation. So that way, even if you're using standard medications like chemotherapy and stuff, your body knows exactly where it needs to target because it's decreasing inflammation in all the other areas. And the synergistic effects with chemo, it reduces the toxicity and some of the side effects of chemo drugs. It improves the patient tolerance and reduces side effects like the real bad nausea and fatigue that most people are used to. There's no interference with chemo, and actually, it enhances the response in some of the cancers. And clinical studies also show a lot of promise in ovarian, pancreatic, and colorectal cancers. The dosaging, like I said, it's the typical IV dosaging ranges from 25 grams to 100 grams depending on the patient's tolerance. And we also do G6PD testing, which is mandatory to prevent any type of breakup of the red blood cells. And typically we'll administer it 2 to 3 times per week along with some other stuff. Here at our office, we're really big on ozone infusions and things like that. Generally, it's well tolerated. There's a low incidence of side effects, although it is given over an hour and a half, 2 hours, sometimes 3 hour period of time. So that way your dosaging is safe and we're not getting phlebitis and some side effects from it. Clinical research overview, the NIH NCI funded trials also show improved quality of life and symptom relief. Studies ongoing right now are on breast cancer, lung cancer, and especially glioblastoma, which is one of the really bad cancers you can get. And the phase 1 and 2 trials also suggest the potential for survival rates actually go up. So the evidence really supports integrating into oncology protocols. The Venturis Clinic protocol is a little different. So we also do personalized cancer support plans combining vitamin IV, but we also like using things like ozone therapy, photobiomodulation, and it's a very patient-centered model focusing on the immune system itself. We want to detox and get the stuff out of there. The close coordination with oncology teams to ensure safety and efficacy is always welcome, and it's optimized for those with pancreatic, breast, prostate, and colon cancers. So, in conclusion, the high dose vitamin C represents a very promising complementary strategy. So at Venturis, we are committed to evidence-based integrative cancer care. So if you need something, you can call us at 405-848-7246, or you can visit us on the web at venturisclinic.com, where you can always find more information.